facilities that are available. So today we want to just have an analysis of what that state of our healthcare system looks like at the moment, and we would like to speak about that also in the context of devolution. Remember, the governors are being sworn in today, so devolution proper begins, which means we're devolving everything, resources, including everything within the health sector, to the county level. Are we prepared for this, and what do we need to do to get ready for that? Dr. Wambui Waithaka is the National Treasurer for the Kenya Medical Practitioners, Pharmacists and Dentists Union, joins us today to talk about that. And you primarily work in the public healthcare system.
Yes.
So this would be an important discussion for us to have. Let's talk about that state of our healthcare system in the country. We do know what happens within the private hospitals, and they have all the facilities. But let's talk about our public healthcare system. What is the state of that in the country at the moment?
Okay, thanks for having me on the show. The public health, first we have to understand completely that Kenyans are found in the public hospital. Kenyans, because the public hospitals are the most accessible hospitals in the country. People go to public hospitals. If you want the numbers of patients, they are in the public hospitals. Private hospitals, they account for less than 10% of the population of the country in its entirety. So public hospitals are the solution to the healthcare system. Public hospitals are what we have to think about in the healthcare system. As we speak, we have a few gains since the last time we were talking about the state of healthcare. Gains in terms of, now we saw during the campaigns, you saw that healthcare became a national agenda. People were actually talking about healthcare. Presidential candidates were giving us manifestos for healthcare. Parties, everyone was planning for healthcare. So that was very exciting, and also it gives us something to look forward to. But going back to work immediately, it means, you know, everything still stays quite the same as it is. It's still sad. The statistics remain the same. 26 women dying every day at childbirth. It's like
26 women dying every day
in Kenya. Those are the statistics right now, and that's not as scary as 300 children under the age of 5 years. Same every day. Those are the reported cases from preventable illnesses, being pneumonia. Our babies dying of pneumonia and diarrhea. It's outrageous, and we are hoping this picture will be something we'll be talking about in history from now on. That from now on, going forward, we are not going to bury our heads in the sand about this. And we're also looking forward to more doctors, more health workers. You know, doctors were such a scarce population. It's pretty outrageous to see that a statistic, there's 2,700 doctors in Kenya touching patients in the hospitals. Yet in the United Kingdom today, there are 2,700 doctors living and working, Kenyan doctors living and working. So we lose doctors like there's no tomorrow in Kenya. They migrate, they're everywhere in Africa, they're in the United Kingdom, they're in the United States. So we're also hoping that this will also be something that we tell our children as part of our history, that there was a dark time in Kenya in the health sector, and this is how it was. Because now there's a little bit of excitement with devolution, because we feel like devolution, we're going to see fundamental reform. What is fundamental reform is distributing power and also broadening participation and influence. We're going to have very specific, specialized solutions to very specific problems. Now, as a county, we can look into, say, for example, Nairobi County, and say, our babies are dying of pneumonia. Why? Because they're predisposed to the rickets. Why are they getting rickets and not getting vitamin D? Why aren't they getting vitamin D and they sun every day in Nairobi? It's because they're living in these urban settlements where their houses are one on top of the other. So babies are walking there, they're never getting sunlight. So we're going to be able to narrow down and get a really specific solution to that problem.
So what you're saying is, obviously we will be able to take a look at, of course, Nairobi County, the problems in the health sector are very different from Garissa, for example.
Exactly.
So with devolution, we will be able to zero in on the issues affecting people in different counties, which are unique.
Yes, which is very exciting at this time. There is a few, that's to look forward to, definitely a lot to look forward to there, and very direct. The influence, like now the influence is coming right next to us. There's no longer long distance management and leadership. No, it is actually your county director of health. If you have an issue, you'll be able to just walk up and say, look what's happening in my town where I live, or in my village, it's like this and like that. So we're going to be able to sit down and have committees that we hope look into very specific areas. Yes, so that we have to say hongera to the Katiba, and well done.
And well done for the devolution process. But even as we discuss that, we're alive to the fact that the public health sector faces very many challenges. You've talked about the fact that our doctors are everywhere. We have a brain drain, and there's obviously a problem.
There's a big
why
problem.
Everybody's moving to the UK and to the US and to South Africa as well. Yes. So let's talk about some of those challenges and hopefully see how we can try and sort those out lest we devolve the challenges at the national level to the county level. So let's talk about the challenges. We've talked about this from the patient's point of view. It would be interesting to hear from a medical practitioner's point of view the challenges that you face in your day-to-day work.
Okay, imagine a scenario where a medical doctor trained and fully skilled in a national referral hospital loses 4 babies in one night, in one shift. Not because she didn't have the skills, not because she didn't have the knowledge, but simply because there's no oxygen. There was 1 oxygen tank, and there are 4 mothers holding out their dying babies to you, and you have to make a choice. Now, that medical doctor was me. That was a scenario that I have faced in my practice. How do you choose? And literally, who makes you God? And it's here we are. So what happened that night was, for me, it was life-changing. Now, this is not an isolated case. I'm not one lone crusader on this. This happens to doctors all over Kenya. So we get demotivated by that. You need facilities. Because what we do, we actually deal with a broken person. So you need facilities to help them. So that situation breaks a mother, it breaks a doctor. So you read about other health systems, you watch them on TV, and you're so knowledgeable. Even now, social media, you can talk and chat and exchange things. And you're like, but I'm you. How come your experience of medicine is so much better? So there's one, the facilities break us down. Secondly, motivation for going back to school. Our higher learning center is University of Nairobi, and now Moi Referral Hospital. We have to go there, so all of us have to channel in there. There's only a certain limited number of spaces, so we're all trying to get in there. And the way we are trained, we're trained. I always say medical school is like, it felt for me, and in practice of medicine in civil service feels like the military. One, you're trained and you're trained. We have an intensive training process. There's no guesswork. There's no chances. There's no second chances. One, so we train, and then you go to the public system, and you're told Kenya needs you. So you, Yvonne, are going to Garissa to serve Kenya, and so you go to Garissa and you serve, and then you have to get better. You have to specialize. So you go back to school and so there's an intense lifestyle. So there is limited spaces, higher learning, so doctors now, we want to train, we want to get better, I want to give back. So now, I can't get into Nairobi University because their only pediatrics class takes probably 80 students. I wanted to get in, I didn't get in this year, so, and other people have been waiting to get in, so I'm like, wait a minute, why don't I just apply for a scholarship, leave? I go there, and then I experience better money. I experience better facilities. I experience research. Like now I experience medicine for what it was supposed to be, how we read. It'll be a really difficult story to getting them to come back. So one of the things that we've looked at, and one of the areas that we've seen, is the employment of doctors, the recruitment of doctors, the deployment of doctors, the training of doctors, even the dismissal and the sacking of doctors requires to be it's a specialized area. So in the beginning of the writing of the Constitution, they wrote about something called the Health Services Commission, whose mandate was to manage health workers. So somehow in the Naivasha, when they went in it disappeared. Basically, the Constitution does not provide for a Health Services Commission. We're still under the Public Service Commission. That has provided so many challenges in the human resource, the health workforce. We're looking to take it to Parliament that they need to re-establish this. It will be made up of health workers who understand our psyche, who understand the training, who understand the facilities, and be able to motivate the health workers. So what you're saying is it wouldn't be sufficient to be under the PSC? Not anymore. Times are changing, they're changing too fast, and unfortunately the PSC, it's overstretched, and we're very specific, dealing with very specific, trained in a very specific way. I remember Brother Toli Francis once said, the problem with the thing about doctors, when they sit down together and they're all talking their language, they're understanding each other, but as an outsider, you're like, what are they saying? So with that kind of specificity, it needs to, we need to be able to run our trainings and run our experience. So the Health Services Commission, it is due. It is due. So we're looking forward to this Parliament sits, and the first thing we have to approach the Parliament and tell them, please pass a bill, allow us to be able to have some of the challenges, just to encapsulate what you've said: facilities, supplies, drugs, equipment, funding, of course, for all of that would provide some of those. And then you've also talked about access to better specialized education. Exactly. Research, which is very important. And of course, all of this, many people would say, okay, so that's good for the doctor, that they get
more fancy equipment, that they get better education, that they have their own health commission that deals with their issues specifically. How does that affect me, the patient, when I go to Kenyatta National Hospital, when all of these things are lacking for you? In other words, bring it into context for the consumer of the services, which is the patient. When you have no equipment, like you talked about, you have to make a choice. But just put it in that context of the patient, how all of these challenges then affect the patient at the end of the day.
Okay, I'm a doctor, not for me, for you. If I get better at something, it's not, I don't use it on myself, I use it on you. For example, my passion is neonatology. I love babies, newborns. I say these are the only innocent Kenyans, and I love them and I deal with them every day. When I get better skilled at my neonatology, I will never be a neonate again. So I'm not helping myself. I will. It is for you.
Yes.
And I'm in a scenario where I deal with every day 70 to 90 babies. I work in Pumwani maternity newborn, which is now baby. My newborn unit is a real baby zone. So my skills are for every day. My skills are for 70 babies, future Kenyans. So what benefits me? What it looks like it benefits me. It benefits me that I'm there. It benefits me that I get better skills. But in actual fact, I never treat myself. It's for you. It's for you. It's for that mother to never have a situation where they say, I don't know what that doctor said, or they said she doesn't know. Then she Googles and finds that I should have known something that I know. It is specifically when you educate a doctor, it's not security for the doctor and the doctor's family. It is security for the nation.
Okay.
Yes.
Indeed, you're not a doctor for yourself.
At all. And also, it's important for us because a patient may never be a doctor, but a doctor will always be a patient. There's going to reach a day where I will need an ear specialist, and I want him to be the best. Yeah.
Very well said. A patient may never be a doctor, but a doctor will always be a patient.
Yes.
And so that is who all of this is geared towards in the end.
Yes.
So let's talk about your union now, and taking a look at some of these challenges that you face, and you working in Pumwani. It gets to the point where, first of all, do you have that question that your contemporaries ask you, so why are you working in Pumwani? I mean, why not go to Nairobi Hospital or some of the other ones that have, what it is they need, or for heaven's sake, you've studied this for 6 years and you're doing very well at it. Why not just go abroad? Why work in Pumwani? I'm
going to tell you, that's a daily challenge. Every day it's a challenge. And then now it's not even just people want you to go to Aga Khan and Nairobi Hospital. They're like, we in America, we're doing this and this. Come. You need a scholarship? Come. Like, there is the magnetic force that's pulling health workers out of this country is very strong.
Boy, what keeps you at Pumwani with all of this? Because for sure, you could be having this discussion at a television station in the US and not here and talking about Pumwani and talking about the challenges that you have to face and choosing between who lives and who dies based on the equipment that you've got. Why stay at Pumwani?
If we all leave, who's going to do it? Someone has to do it. So we can't all leave one. And then this situation is fixable. I completely, every day in my daily round, I see the solutions amongst us. The solution's not going to come from the sky or somewhere. So they're here. So it's a matter of implementing the solutions. Being, as Wangari Maathai's hummingbird, doing the little that you can, where you can, exactly where you are. I'm not, at least even this year, I was going to apply and go, but I was like, let me give it one more year and let me see what we can bring back, because I was educated by the community, I was educated by my family, and then everything, the support group. So I need to give back. There's a feeling of giving back, and then there's a feeling of let's not all leave, and then there's a feeling of not just yet.
Okay.
Yes, and particularly, Kenya is on the brink. Don't you feel that?
Yeah.
Watching, like we're living in exciting times.
Exactly.
Watching the Supreme Court, watching. I was watching everything, and I was
process,
like, I cannot wait for the day that we watch those who are interested a heart surgery, like a heart bypass or a cochlear transplant, or
live on
television from Kenyatta National Hospital or Moi referral. So I'm still able to dream those dreams for the health sector. So, and I still see that we can do it. The solutions are here. Governance, leadership, pass the right laws, invest in health workforce, health service delivery, gives us specific solutions for specific problems. We are able to do it. We can get there with the right team. All right.
So speaking of solutions, I know some doctors have tried to come up and say something's not right. The government hasn't been very friendly to you in that regard. But let's talk about some of the solutions that you have in mind for some of these issues.
One, the health workforce, the solution to the health workforce, we cannot resist it anymore. It's the Health Services Commission. That we need to manage the health workforce properly, and that's the way to do it. Funding, we have the solution. We assign the Abuja Declaration to 15% of the budget.
Yes.
What we need to do is stop working backwards and work forwards.
Okay.
Every year we keep cutting it down, now start increasing it. Same thing at the county level, advise the county level that when they get their money, 15% of that should go into healthcare. Be open and willing to, like, roll up your sleeves. There's no, we are the government, so we are going to fix this. We're going to fix it together. Kenya Medical Supplies Agency, you need to get better at your job, because at least now it's wonderful. They're going to have competition with the county.
With the counties,
so they've got to
right,
deliver on time. They've got to have standards, all this quality assurance. That's where it's coming from. Health information systems, we need to go digital. It's over. This writing on paper, it's over. We cannot be expecting to be moving to getting our data, because you know data in healthcare is what gives you solutions.
Indeed.
Yes, so those solutions are there. There is the defining exactly what a hospital should do, what's a provincial, because now you know the constitution said national and then county. It didn't say provincial, and provincials are referrals.
Yes.
So now you have a situation where you have, for example, Nyeri General will now belong to Nyeri County, yet Nyeri General belongs to Central Province. So where are those other patients going to go? And if they come to Nyeri General, like the solution, these things need to be discussed openly, and then they need to be given to the people. The solution has to come from the people. The patient's health rights charter. Yvonne, now you have rights. There's a charter that was written that says you have a right to health care, that says you have a right to insurance, that says you have responsibilities, like to tell the truth.
As a patient.
Like, yes, those things, because patients never tell the truth. Patients need to start telling the truth. So there's all these things that are coming up, and spaces that are looking into these things. So it's about rolling up our sleeves and finding these solutions.
And so several times when you know, the union calls for a strike of its workers, you get demonized by the public. How can you go on strike and leave your patients suffering? Let's talk about some of the reasons you go on strike. Is it because of everything that you see on a daily basis?
Yes, there's that. We came from a very long history where we weren't allowed, first of all, to be annoyed. We weren't allowed to be frustrated. We weren't allowed. We were told it's a calling, and it's a calling, and became a calling to many things. A calling to suffering, a calling to poverty, a calling to so many, to not speak out. So we got a new constitution, as once again Hongera Katiba. So we were able to now come out and be able to be open and say certain things. So when we started discussing this, meeting and exchanging our experiences, what we found was, first, you're not isolated. So there's consolation knowing that I'm not the only one who's suffering this health system. It's broken everywhere. And then it was a question, so now what are we going to do? And when you start asking what are we going to do, the question became, how can we not strike? We're a union.
And doing that is not just for you and your salaries and your pay?
It's not. It's not just for that. It's not. It is our union is supposed to fight for the welfare of its members. So we do have a pillar for welfare of our members, but our other also very important pillar is to improve the health sector in Kenya. So which benefits the patient? Which benefits the patient, benefits the doctor once again. So now we are hoping that we have completely moved away from a situation where industrial action is the last resort. Like it should be the completely last resort. Now we're looking to build fundamental partnerships, work together with the government. The government is changing, which is good again. So we're looking to work with that. We're advising at the levels of the county, because we're a national union, so we have our branches, they're advising governors and the directors of health. So we want to build it in such a way that you do not reach a situation where it's broken and you wonder, where did the cracks begin? Indeed.
And very quickly, because we do have to wrap this up and move to the Supreme Court, like you said, exciting times. You're not just talking about going on strike and talking about industrial action. As doctors, you're also doing something about it. And I know Pumwani is one of the biggest hospitals. I think literally everybody who's somebody and everybody who's...
Can I do a little list of the people who... We have
very quickly.
We did an audit on who were the Pumwani babies, people who have been born in Pumwani. The Pumwani babies include Uhuru Kenyatta, President-elect. Uhuru Kenyatta's mother, Mama Ngina, gave birth to Uhuru in Pumwani and also gave birth to his sister Margaret in Pumwani Hospital. Our governor of Nairobi, Evans Kidero, is a Pumwani baby. Peter Kenneth is a Pumwani baby. Betty Tet and Fred Gumo, who have always been fighting for the Western's constituency seat, they're both Pumwani babies. Juakali is a Pumwani baby. Nonini is a Pumwani baby. Mumbi Kaigwa is a Pumwani baby. We have, the list is alumni like there's no tomorrow. So we have now put together an initiative that's been under the umbrella of Maurice Moses Foundation, which is the patient's rights foundation. Yes, so they've come to Pumwani, and Alice Mongera is also a Pumwani baby herself. So she's working in partnership with Pumwani Maternity, with us, to look for ways in which we can refurbish. We need to put it back together so that it can be a kind of hospital that a president, a governor
Yes.
should be able to be born into.
Absolutely.
So we're not just industrial action, we're also moving now to finding solutions, finding all the different type of solutions, getting the initiatives together, giving our skills, our knowledge, and all our talents into doing that. So Pumwani Babies is something to look forward to. Save the Cradle. They're going to get me a new newborn unit for all of Kenya.
Oh, that's nice.
That would be wonderful.
Okay.
So make a difference for all the mothers who are coming. And the statistics are high. For example, to say quickly, in 2012, Pumwani Hospital was a maternity of choice. No one forced them to come for 17,700 women.
Okay.
17,000, that's a household. Those are 17,000 households who came to give birth.
Right.
So Pumwani is an icon. It should be the Masai Mara of maternity in Kenya.
Indeed.
Yes.
And it is the biggest maternity hospital in sub-Saharan
Africa.
So
and the third busiest maternity hospital in Africa.
Wow.
So we need to build it up, take it back up, so that it can be something. Brand Kenya needs to be able to say we also have this incredible facility.
All right, and you know, having medical tourism as well. If you want to have a baby, come to it at Pumwani. And we should be pushing for that. And that is exciting to hear that doctors are not just about industrial action and talking about their own salaries, but that every day their initiatives are based towards the patient, and it's all for the better service that they can provide to the patients. And it's not just about industrial action, it's about that initiative that you are taking up. And thank you very much for joining us. We will be discussing this again further. Yes. Obviously having you on the show again to now talk about that Pumwani project in greater detail. We want to have some of those ambassadors here.
Yes, that would be so exciting.
And talk about
exciting.
that, yes.
And then
and talk about the issues that Pumwani is facing also in greater detail. So that will be good. 17,700 women went to Pumwani last year alone just to have their babies, and by choice.
And by choice.
Nobody forced them. That's important. Thank you very much.
Thank you, Yvonne.
We will continue with this discussion. So, of course, next week and in the weeks to come, definitely have you on the show again. We've been speaking to Dr. Wambui Waithaka, who's the National Treasurer, Kenya Medical Practitioners, Pharmacists and Dentists Union, talking about the crisis in the health sector and also providing solutions, which is what we are about at Sunrise Live. We don't just whine about the problems. Dr. Wambui Waithaka and the union do have some solutions, and one of those is that Pumwani initiative. If you can follow her on Twitter, she has all of those little things, and it's definitely something you want to do about that. So I'll be tweeting a little bit about that later as well. And if you want to know more about that, next week, the weeks to come, Wambui Waithaka will be with us again.